And we're off. Morning, everybody. Welcome to the first speaker session of the day. Just a couple of housekeeping things, which will be the same at all the sessions, so you won't have to listen to it in this much depth as you go around the others. But make sure you have the Slido app downloaded if you haven't already, so that you can ask questions, which we can take at the end of this speaker session. If you haven't got that, if you go to slido.com and then search for hashtag REBA Congress, then that enables you to select the room that we're in, which is Synergy 1 and 2, and then you can type in your question. So please do ask questions. I know our speakers are keen to have some. Also at the end, I'll be asking you to rate the session. Please do that again through the Slido app because it's really helpful to get that feedback to shape future REBA Congresses. Some of your sessions, not in this one today, will have a poll where you vote on Slido, which you may have seen in the opening and keynote speeches earlier, but we haven't got one in this speaker session. So let's not have any more time with me. Let's welcome to the stage our speakers from Mercer Marsh Benefits Global, Iain and Ting, and they're going to talk to us about the role of tech in really maximising the value and the impact of health and wellbeing benefits in global organisations. Welcome.
Thank you.
Thanks so much. Hi, everyone. It's great to see so many of you here today in our first session. So we are Mercer Marsh Benefits, and as Jen mentioned, we're here to talk to you today about how technology can really increase access to benefits for your employee populations and how you can leverage this technology to really move the needle on workplace well-being and really shift from that reactive approach to potentially a more proactive, preventative health and well-being strategy. So a lot of the data that you'll hear today actually comes fresh off the press from our 2025 Health on Demand report. It's available to download from our website if you just want to come talk to us after this session. We're also outside at a stand so we can direct you to the right place. But our Health on Demand report essentially interviewed over 18,000 employees from all geographies to really get what they perceive as what's going to be impactful health and benefits options for them. And so we're going to present some of those to you today. But if I just start with some quick introductions, my name's Ting. I'm a digital proposition lead here at Mercer Marsh Benefits. I've actually been with the company for about 8 years now. I started in our multinational consulting group, so I've worked with a lot of you today, if you are a multinational, on health and benefit strategy. And also in the last couple of years, I spent working on digital health and digital benefits technology solutions. So looking forward to kind of talking about both of those worlds with you today. I'm joined by my colleague Iain, whom I'll let introduce himself.
Thanks, Ting. So Iain Clack, I'm the Global Commercial Director for Darwin. Darwin is Mercer Marsh Benefits employee benefits facing technology. So similar, I've been around for a number of years in Mercer Marsh Benefits, and before that around about 20 years in employee and HR technology. So starting with what we're going to be covering today, I think probably the first and most important point to raise is we don't see technology as a magic wand to resolve all ill-being. Far from it. But we think there's a very important step that technology can bring in terms of guiding employees on their journey around your well-being strategy that helps mitigate a lot of ill-being and creates an enhancement of your well-being strategy to drive a resilient, focused, engaged, and attractive employee proposition. And I'm going to be covering the first couple of topics on that, and then Ting's going to be picking it up. So Ting mentioned our Health on Demand report, and that brings up three key areas. Firstly, how can you create the journey from access to benefits technology to a true impact on employees' health and well-being? Well, the first step is by creating those meaningful connections between the employee and their benefits. And when we talk about meaningful connections, what we mean is the ability for an employee to have an understanding and an appreciation of those benefits and how they resonate with them and where they are in their life. Secondly, it's important that those benefits have a truly personal impact. So they should be communicated in a way and tailored in a way that feels that they are personally impactful for that individual. When you do that, that is the greatest hook possible to retaining that member of staff. We've seen that where that's available, retention grows by 60% in terms of employees who have access to those kind of personalised benefits. And finally, I'm going to be handing over to Ting, who's going to be looking at how do we drive effective transformation through technology. So how do we transform what is currently a theoretical or paper-based wellbeing strategy into a truly dynamic, live, accessible digital gateway into a full benefit strategy on technology. So we're going to start by looking at some of the issues and opportunities that there are in the market. And first of all, I'd like to draw your attention on this slide to the middle two columns. What jumps out straight away from our research is where you have access to benefits technology in any form, the outcomes for an employee immediately improve. Whether it's about feeling that your employee caters for your well-being, that you feel that you can thrive in that organisation, that you feel that you have an understanding and an appreciation of your benefits, they all rise massively when you have a technology that allows for the effective communication and selection of those benefits. But for this talk today, I really want to focus on the fourth column where we've highlighted it in blue. And that is employees who are already in some form of ill-being situation, whether that's a long-term issue or short-term. We've classed them all as being within that ill-being sector. You can see that the satisfaction drops considerably when you're in that position. And we think there are two key reasons from our research why. Firstly, when you are in that ill-being situation, you want rapid access to information. You want to be able to understand your benefits, how you can claim, have access to those on the go. And unfortunately, in the market, there is a lot of benefits technology that still does not cater for that on-the-go, easy access movement. Secondly, there will be a number of employees in that group who could have been prevented from moving into that group through access to best-of-breed technology. Our research shows that where you actually build campaigns and you allow access to things like employee assistance programs, self-help guides, mental health awareness apps, we actually see a massive uptick in people being prevented from going into a situation where they start to claim against significantly more expensive benefits, such as private medical insurance. 80% of all claims being made on high-cost benefits are driven by just 20% of employees. And many of that 20% of employees will be in that situation. So the more that we can mitigate that, the more that we can move away from that being a situation that grows and grows, the better. Secondly, we see that attrition of employees who are in that ill-being is significantly higher than those who are healthy, because they start to actually look around for better benefits packages and better ways of assisting with their longer-term needs. But what's surprising is, when we did our survey, and Ting mentioned it's across 18,000 employees, only 26% of respondents said that they view an employee benefits system as their go-to place to find out information about their benefits and their well-being strategy. And the reason why that's interesting is we know that across Europe, Middle East and Africa, 60% of all employees have access to benefits technology, which means that there's a problem. Somewhere along the line, people aren't being engaged with their benefits and they're not going to the benefits technology that could be helping them. Whether that's a communication issue, an engagement issue, not knowing it's there, or whether it's the technology itself is not actually supporting the employee at the time of need. They're far more reliant on things like company communication channels, provider literature, and events like benefits fairs. But where you have best-of-breed technology, you can actually bring all of this together in a one-stop shop to deliver this holistically across all employees, making it far more efficient and far more effective for employees, regardless of their needs. And that's why we see across the C-suite focus in the employee survey that we just did, there's a massive focus on investing in benefits technology, either upgrading the technology that exists today, or if you're in that 40%, moving into delivering technology for the first time. Now, across that survey, globally, the number one standout reason for doing that time and time again is because there is a desire to improve employees' health and well-being. In our survey, we see that the cost of rehiring an employee on average across Europe is 45,000 euros. That's additional cost on top of any other cost you have around like salary. That rises significantly in high-cost countries like the UK. So there is a desire to have a resilient, productive, engaged workforce that want to remain with you as an employer. When you take best of breed technology as well, and you bring in the other 5 elements that are on here around things like cost control, employee experience, the use of future-proof technology built with AI, you actually start to then build a simpler, better, safer, faster way of delivering that message to your employees. Now, I mentioned at the start the thing about impactful personalization. It's great that the C-suite want to invest in benefits technology. And we know that benefits cost, on average across Europe, around about 15 to 20% of the overall payroll bill. So you've made the decision that you're delivering technology, you've made the decision to invest in benefits, which is fantastic and great employer to be doing that. But if you're going to make this truly resonate, you have to be able to deliver it in an impactful way that personalizes those benefits for an individual. The reason being is the conversation is moving on from return on investment. The return on investment of getting people to engage with your benefits is very important. But actually the value of investment of getting engaged employees with their personalized benefits means that you start to create a more societal level change in your employee group, a level where people see it as a thriving, holistic, well cared for organization, and you attract and retain the top talent. And we can see now that the tide has turned. You know, if we were doing this 5 years ago, these numbers would be significantly smaller. The ability to actually personalize benefits packages was much lower, and actually there was a lot of resistance in employers from actually wanting to do it because they felt that there was a number of costs associated with it. But the growth of technology, the growth of AI especially, and the ability to tailor packages means that we've seen a massive increase in the tailored benefits space. Now, what that does is that drives a huge amount of trust in terms of the engagement between the employee and the employer, because they feel that those benefits are actually being given to them at their moment in need. And that trust grows even more significant when you start to then talk about health benefits. So we've seen in our survey that, you know, in the high 60%, most employees would be willing to give significant amounts of their personal health information if it meant that they could have truly tailored health benefits. Now, that number increases significantly when you look at 2 groups. Firstly, those with a long-term disability, and secondly, those in the so-called sandwich generation. So people who are dealing not only with their own health issues, but their health issues of a parent or somebody else that they care for who's older than them, and also children and dependents. In that instance, there is both an increase in stress, anxiety, and mental health issues with the person involved, which we've seen through our survey, but equally, they're looking for very significant personalized dependent care, which by being able to develop these personalized benefits really helps drive that. Now, I've been talking a lot about kind of what's out there at the moment, how people are selecting, and the kind of gaps that exist. But now Ting's going to go on to look more at how are we transforming that and what does the market look like in the future.
Thanks, Iain. So Iain talked a lot about the why benefits technology is important, why the C-suite's investing in it, the number one reason being wanting to improve the health and well-being of their employees. We know that's a huge ask for you sat here as HR professionals. That's not an easy thing to do. And so what we're talking about in this section is how technology can be leveraged to help you really move that needle and improve your workforce health and well-being. At the foundation of a how is a concept that we talk a lot about at MMB, and it's this concept of a digital front door. A digital front door creates an entry point for your employees to their entire health and benefits ecosystem. And the reason why this is important is because our survey showed that over 2/3 of employees have delayed seeking access to care because of the complexities in navigating their healthcare platforms, their healthcare options. It's not about that they don't have this accessibility into these benefits, but it's the navigating around all the different options that they have available. And so what this digital front door concept does is try to mitigate those risks, mitigate the risk of employees delaying access to care so that they're not potentially improving the probability of serious worsening health conditions. Things like preventative health screenings for cancer is important for that. And so digital front door helps give employees access to the right care at the right time that they need. If we dive deeper into what goes into really an impactful digital front door experience, we've broken it down into 3 main sections. So the first is just talking about access to core company benefits. This is things like your private medical insurance, your disability information, for example, and I guess what we call the unsexy parts of health benefits, but so important. If you think about things like, where can I get my group policy number? Where can I get my individual policy number? Who's my provider for medical? Who's my provider for EAP? Who's my provider for IVF services? Is that the same as PMI? These are all the questions going around in employees' heads, and a digital front door experience helps reduce that burden. The second part of a digital front door that we talk about is all the products and services that you as an employer offer to your employees to enhance their health. So we'll talk about things later on about potentially the increasing digital health innovations. Over the last couple of years, there's been a huge increase in telemedicine providers, and it's important to ensure that you as employers incorporate all these benefits into one easy access point on this front door experience for your employees so they know exactly where to go to get that information. And lastly, what we talk about is this engagement aspect with employees. So our survey showed, and I actually really love this stat, that globally on average, employees trust their employer as the #1 most trusted source for access to care and healthcare information. This is above government institutions, and this is above private programs. So that's huge. It gives employers a huge responsibility, but also an opportunity to engage with their employee populations on healthcare resources and educational materials, all on this front door experience that their employees can benefit from. If we dive deeper into the ecosystems that's built around this front door experience, I think this slide shouldn't be too much of a surprise to anyone sat in this room. We talk a lot about healthcare from the various pillars of health. We have physical health, we have mental well-being, we have financial well-being, also social. And over the last few years, what we found is employers are increasing the number of options available to their employees to access care outside of traditional medical insurances. So this is access to things like telemedicine. This is access to things like chronic illness management platforms, things like diabetes care, for example, also e-pharmacy benefits, and also what we call as the life stage care type benefits. So women's health, men's health, even more we talk about aging and longevity. With all these increased options, that's great, but then for an employee, that sometimes means almost like a paradox of choice situation. There's so much choice in terms of what they have available to offer, and sometimes that kind of creates that paralysis. It comes back to that stat I was talking about, the 2/3 of employees delaying access to care just because they don't know where to go. And so this is where technology can play a huge role. If we talk about things like integrations, if I keep it at the simplest level, I'm not a technical person myself, but if we talk about an integration, what we mean is that on this front door experience, can you think about integrating all these different providers onto one place so the employee doesn't even have to remember the name of the provider. They don't have to remember what website to go to. They just go into that front door experience, they click on access the website, they're logged in immediately, they don't have to remember a different password, and all the focus is about getting the care that they need. On a slightly further kind of integration care complexities, what we call integrated care pathways. And that's something we're working a lot with our clients on this journey. And if I take the example of mental health care, some employers offer mental health risk assessments for their employees, either on-site or in clinic. If an employee is flagged as high risk on a mental health score, right, the last thing that you as an employer want to be doing is adding that additional burden of care for an employee to then know, what do I do with this score? Who do I go to for help? Say, I've been identified as high risk for burnout. What integrated care pathways does via technology is that it can identify that individual and immediately personalize the benefits available to them to direct them to the appropriate EAP or mental health care resources automatically on this digital front door experience. So they don't even have to think about it. They can be prompted to access the care that they need when they need it. So another kind of really topical thing coming up is that across the globe, we know healthcare systems are really struggling. They're understaffed, completely under-resourced, and there's a huge demand now, actually, from employees looking to employers to potentially increase the number of ways that they can gain available access to care. And there's a huge opportunity here for employees to also take advantage of the innovations coming out of healthcare. And one of those being kind of preventative health solutions. So I've actually just come back from a big health tech conference in Amsterdam called Health Europe yesterday. And all across this conference, you have hundreds of people talking about the same thing around preventative health and well-being. It's about how we can move the needle in healthcare today around taking advantage of things now. Like, it's incredible what we can do in terms of AI diagnostic tools to diagnose individuals faster and more accurately. AI diagnostic tools have been shown to show up to 97% accuracy in diagnosing cardiovascular disease. And all of this is being done digitally and helping save healthcare costs and potentially employers a huge amount of money in terms of these preventative services. The one thing I kind of wanted to pull out from this slide here, if you see it on the slide, is apps and devices to self-manage health conditions. So think about this as self-management conditions for things like diabetes care. What came out from our survey that I find really interesting is that employees actually value things like wearable devices and these apps for self-managing their conditions over and above traditional core insurances. So that means that they're looking to manage their diabetes via a digital app rather than trying to access their care through their PMI, going to a doctor's office, trying to get their prescription drugs via that way. So that's a really just interesting thing to think about for you as an employer as healthcare starts to move more digital and into this preventative health and well-being space. Now, this is my last slide, and I'd be remiss to talk about technology if I didn't mention AI in some form. These are just some of the ways that we're seeing AI being used in our industry across benefits professionals, across healthcare. But the thing that I wanted to talk about the most here is we've come back to the concept of our digital front door. That gives you your foundation of a technology by which you can then move into the next phase of technical innovation by leveraging AI. So that digital front door was all about helping employees navigate their various benefits and health and well-being resources available to them. Coming back to what Iain talked about the importance of personalization, that's where AI can really help us. An AI layer kind of integrated onto that digital front door experience to personalize benefits navigation and care navigation for that individual employee is going to make that much more of a difference in kind of shifting us towards a preventative health and kind of personalized care approach. So I'll end there in terms of talking about AI use cases and health and benefits and pass back to Iain to just kind of wrap us up for the day.
Thanks, Ting. And an awful lot to take in, I know, but what we wanted to summarise at the end was wherever you are, right, on the journey to doing this, it doesn't matter. There's a starting point because it's a cyclical journey. Because you have to create the ease, you have to create the access. When you've done that, you start to get the employee appreciation, you start to get the engagement. When you do that, you build your resilience in your workforce. And by doing that, you start to get a greater return on investment in your benefits spend, allowing you to invest again and reinvest in your well-being and your benefit strategy, which ultimately means you've got to communicate it again. So wherever you are on this journey, there's always a starting point. We would be more than happy to take any questions or if anybody wants to see us on the stand afterwards. But firstly, I just wanted to say thank you all for joining us today. It's greatly appreciated, and thank you for your time.
Thank you. I think we've got time for just one question, so I'm going to combine two and squeak them in together. Or they've just disappeared from the screen on here, but I can remember what they were. So is there a different approach needed to engage very different segments or sectors of the workforce? And in with that, those that don't have company-provided tech, so they may not have a tablet, a company phone or a laptop, how would you address that side?
Yeah, so I think it's a great question, and it's one that we see build up more and more in the market at the moment. So if you think about, for example, a major clothes retailer. You will have head office staff, you'll have shop-based staff, you'll have manufacturing and potentially warehousing staff. They all have very different needs and very different access points. And that's why best-of-breed technology should be something that you can access wherever, whenever, however you need. So it shouldn't be based only on a corporate login. It shouldn't be based on only having a corporate email or only having a laptop or a desktop. It should be something that allows you to have ease of access from mobile devices that you own yourself or iPads, with biometrics rather than, having to go through corporate SSO. Because regardless of what type of employee you are, one day you're going to be sat somewhere wanting immediate information about maybe a health concern. And it doesn't matter whether you're white collar, blue collar, wherever you come from. When you're sat at that moment and you're anxious and you want to know, am I covered? Can I get the cover that I need? How do I get an access code for what I'm being asked to pay for? You put out your phone, you look at it, and just like you'd go on your banking app, best-of-breed technology allows you to do that, and that's how you drive that access.
That's great. Thank you so much. So I think we're out of time on questions, but thank you once again. That's really helpful and super clear. Please, everyone, do remember to rate the session on Slido, and then the next sessions, the masterclasses, are starting at 11:15. Thank you once again.
Thank you.